Hello, and welcome to another TBITalk video. Video tests can be used to diagnose traumatic brain injury in the emergency room. Glasgow Sol Micrometer is used to measure the ability of patients to open their eyes. Patients will experience a certain degree of rehabilitation, but everyone will experience different stages in the same way, or never exceed a certain stage. If you or someone you love has physical damage, you may have traumatic brain injury. Emergency medical care is available for head injury caused by accidents, sports injury, fall, or attack. The words longitude, moderate, can be used to describe the effect of injury on brain function. Most of the patients seen in the hospital, for example, are in the category of severe traumatic brain injury. Some patients can reach a certain level, but not a higher one, while others cannot. If the person you love is within the range of Rancho level 1 to 2, they will fall into a coma, will not respond to stimuli, and will develop into an unstable state. By responding to external stimuli such as noise, lights, voices, and touching, at these stages, patients will require a caregiver or hospital staff to complete all their basic needs. These patients cannot feed themselves and will typically require the use of a feeding tube. Mid-stages 4 to 5, these patients are in the middle of the Rancho scale. When your loved one is in stage 4, these patients can be very confused, agitated, or not agreeable. These patients may not act like themselves, and it can be very difficult to see. In these mid-stages, patients can become more agreeable and more like themselves. However, they may not have great recollection of events and may still be impulsive with poor safety and judgment. Late stages 6 to 7, when your loved one is in the later stages of the Rancho scale, these patients have a better ability to remember day-to-day and week-to-week events, but may still require the use of a memory aid, or might be more frustrated or irritable. Progressing through these stages, the patient can start to multitask with increased time to complete tasks. They can interact more appropriately in social situations, but are at an increased risk of depression. Populations at risk. Certain groups are at a higher risk of TBI, according to the Virus. Men are more likely to get a TBI than women to have a serious TBI. Adults aged 65 and older are at the greatest risk for being hospitalized and dying from a TBI. Children, especially newborns to 4-year-olds, and young adults between ages 15 and 24 also are at a high risk to suffer from a TBI. Prevention of a TBI. Here are a few steps you can take to prevent head injuries and TBIs. 1. Always wear a seatbelt and use car seats and booster seats for children. Never drive under the influence of drugs or alcohol. Wear a properly fitting helmet when riding a bicycle, skateboarding, and playing sports, such as hockey and football. Make your house safer by installing railings on stairs, getting rid of tripping hazards, and using safety gates for young children. Improve your balance and strength with regular physical activity to help prevent falls. Pay close attention to your surroundings. Don't drive, walk, or cross the street while using your phone, tablet, or any smart device. Visit TBITalk.com for more information.